Dr. Vinitha Dubey is an Associate Medical Officer of Health in Toronto. She specializes in immunization and vaccine preventable diseases. Great to have you here.
Thanks for having me.
It's not just the US. In Ontario, measles cases are climbing. How bad is it?
Do you know, as of today, there are over 300 cases of measles in this current outbreak. And just to put that into some context, in the previous 11 years, there were about 100. And we're just into March right now. So the numbers are really, really high.
What does that mean in tangible terms? Because this is a deadly disease, doctor, and I'm seeing it's one of the worst outbreaks in 30 years.
At one point, we were at a place where we were reaching measles elimination, where we hoped that we would have no more measles within our borders. And now we're finding hundreds of cases, which means, of course, we're going to have people who get very sick from measles, including hospitalized and including deaths. And last year, there was a death of a child in our own country, in Ontario, from measles.
Are vaccination rates the problem here?
We need to keep our vaccination rates up without question. We've proven that when our rates are very high, we can keep ourselves protected against measles. And when they fall, even if they just fall a small amount, we will start to see measles and other diseases increase again.
So where are we at in Toronto when it comes to those rates?
We are working hard to get our rates up again. We know in general for some of our, say, school-based vaccinations, where we have restarted the programs since the pandemic, we are still down anywhere between 5 and 11% from where we were beforehand.
Wow.
So we know that there is some hesitancy that is new, that is preventing parents from feeling confident to get their children vaccinated.
So 5 to 11% of kids are not getting vaccinated. When does that become a risk to the wider society?
When we start to see cases turn to outbreaks where large groups of people get infections, and when we, in particular, start to see our vulnerable get very sick from the illness. And for measles, again, small dips in vaccination rates. Like, for example, in Europe, they had vaccination rates in the 80%. And you might think, well, that's pretty good. That was low enough for them to have wide-scale outbreaks.
That was enough,
yeah.
Even at 80%.
That's
so
right.
We can't be too careful. Is misinformation around vaccines, directly tied to these outbreaks?
There's definitely a component of misinformation and disinformation that is drawing people not to vaccinate their children. I mean, you actually showed that really nicely in your opener, dating back to the beginning of vaccines where people are skeptical of it. And there's no question that this piece on MMR and autism that has since been disproven in actually very credible ways, compared groups of children who were vaccinated, groups of children who were unvaccinated, same rates of autism. And yet still we heard about the American government who is now doing another study to look into this, right? And that will just create more skepticism. People might say, well, I'll wait for that study. Maybe there is something here, when actually really it's been disproven. And that has been linked to lower measles vaccination rates.
So in your opinion, there's danger in reopening that conversation when it's been debunked for decades?
We need actually to be positive to really clarify measles vaccines are safe. They are much safer than getting the disease, and the disease is here, it's around, and people are getting it within North America.
RFK is, of course, has the top job in health in the US. He's known for being at least vaccine hesitant. He's talking about things like vitamin A preventing measles. He's talked about cod liver, I've seen, vitamin A and D. Is that enough? Is there any truth to that?
There's no question that being vitamin deficient can give you a more severe illness should you get measles. But to actually prevent measles, you either need to be vaccinated, so if you're exposed, you're protected. You need to either have had measles, so you get the immunity, or you need to not be exposed at all.
So the vaccine, that's not enough, is what you're telling me.
That's right,
The vaccine is your best mode of protection.
It is your best mode of protection.
What would you say to people out there that, are still scared? Like, they still have concerns? Like, what would you tell them?
I understand that. And I think it's okay to have concerns. It's actually great to ask questions. Let's not go into this blindly. And if you have questions or concerns, though, go to your doctor, go to your nurse practitioner if that's what you have, but seek the answers in credible places. Please don't go to WhatsApp or social media or the internet to get your answers.
I think about a world before vaccines. We talked about smallpox. It killed millions. I think about polio, right? A crippling disease that harmed children. We have a few photos of that iron lung that children had to breathe through to survive. What is at stake if this measles outbreak gets further out of control?
Well, let's just talk about our current state. I mean, this past year in Toronto, we had an increase in whooping cough, which is pertussis, probably related as well to lower vaccination rates. We're seeing more measles cases across the province. Like, these diseases that we haven't seen in a long time, they will definitely come back. And the reason why they'll come back is we are a very global city, global province. So all of these diseases that we always say they're just a plane ride away, and they really are. They will come to our city. We saw the rise of Mpox, for example, spread in our city. And so these illnesses will come. If we're not protected, they will find those who are non-immune, and they will get sick.
And right now, it is in our backyard.
It is here, yeah. And so it's actually really a call to parents to say, you know what, maybe you just forgot about it. We will send you reminders, but please look, please check. If you're not sure, talk to your doctor. Don't just sit on the fence. Make an informed choice and really recognize that where we are today, the urgency is real and the risk is real, even for your child right now living in the city or in the province.
Dr. Dubé, great to have you on.
Thanks for having me.